My name is Chris McConnell. I am an advanced dental surgeon and I'm based in Cornwall. I have two practices. One's a generalist practice and it's based on on a lovely beach called Perranporth, which is a lovely surfing beach that we sometimes go to the bar after work in the summer, which is very nice. And then the other practice is a fully digital workflow practice that we set up about 5-6 years ago in the county capital of Truro. I am also past president of the British Academy of Cosmetic Dentistry. I am a key opinion leader with 3Shape, Ivoclar and Edelweiss. And in my spare time, I enjoy surfing, sailing, and trying to learn to kite board, or rather wing foil, which is proving quite painful because it's quite a hard one to do, but it's good fun. So that's Chris McConnell.
So we've heard a lot about digital dentistry. It's a bit of an all-encompassing word. Some people may have heard it. Some people may be getting bored of hearing it. Can you explain to us what is digital dentistry? What does it encompass?
Digital dentistry, exactly as you say, is very a huge wide spectrum. I mean, you could really embrace digital as anything from using an SLR camera to using software for your clinical notes. That's digital. Right through to scanning, printing, milling, 3D smile designs, and using all this sort of stuff. So digital is, without a doubt, digital is within dentistry as a whole, across the whole spectrum. But from the point of view of digital dentistry or digital scanning, that is where I think the most interesting area at the moment is. That's definitely the area of most growth, and most people are getting on board with that now. And really, I think from the point of view of the scanning, it allows us to to educate the patient. It allows us to get the patient on board and involved in their treatment planning. And it also allows you to have more communication with the lab in general. So I think digital dentistry, depending how you look at it, as I said, you can look at it as scanning, or you can look at it as everything that's involved. But from my point of view, yeah, it's very much along the lines of using the technology to improve my outcomes. So especially from the point of view of any veneer smile designs, we can sit down with the patient, we can engage them in the process, we can show them exactly what we're predicted to do at the end, and then we can, with a surety, deliver that at the end. So from a patient's awareness point of view, they know what they're getting. It's all very informed consent. There's no surprises anywhere, and it can be very much controlled. So I believe digital dentistry absolutely is the way forward. It's good for everybody. But there's lots of entry levels for it, depending where you're at.
Why are you so passionate about intraoral scanning? Why do we hear about intraoral scanning so much?
So again, with intraoral scanning, we can be, if that's putting a camera in the mouth and taking images. We can use that for taking a picture, so as to show and educate the patient and show them, look, this is what's going on. Again, or you can be really using intraoral scanning from the point of view of producing a digital 3D shape of the teeth that is then converted and can be used as a file for making crowns, bridges, veneers, dentures, or indirect restorations. I think really, for me, the benefit with it is 100% patient engagement. When patients see what's going on, it's a lot easier to then have them on board with the treatment. The biggest problem that we face in dentistry is that the patient doesn't see what you do. They won't see what you've done afterwards if it's posteriorly even, So they come in and they can't understand what the problem is. They can't see what the problems are. And so all this does is it allows us an opportunity to engage and show. So for me, if the patient is on board with the problem and they own the problem, it's much easier to resolve. And digital for me definitely helps in showing them and educating them to do that. But I have to say, it's not always me that is doing the scanning and educating. If people are clever with the intraoral scanners, digital-wise, they can use nurses, they can use hygiene therapists and everything. So it's a team event rather than singular dentist.
what should we be looking out for now? If we're shopping for an intraoral scanner now, what kind of things should we be looking for? And then what is the next step for intraoral scanners?
This is a question I think that's really, really important. The first thing is to identify why you want to use it. Now, everyone runs out and they go intraoral scanner, and the first thing they do is, well, I want an intraoral scanner. I'm going to look for the cheapest one or the one that I recognize, the easiest. That's completely the wrong call. What you need to do is handbrake it, rewind, and then ask yourself, what am I going to use this scanner for? That's number one. Once you have that, you then want to know how often you're going to be using it. If you're going to be using it for indirect crown bridge stuff, then you need to and you use a lab, then maybe speak with a lab and go, what softwares do they use? Because what you have to remember is that each scanner, the lab will require software for that particular brand scanner as well, and they have to purchase said brand. So if you go and get a random brand that your lab that you use doesn't have in their system, they will have to go and purchase a license to use that. So you may find that your lab will go, we can't accept that. So discuss that with your lab. And then I think also look at the functionality of the scanner and look to see what it can do in addition to maybe what you're doing now, so you can grow with it. So there are lots of scanners out there. Some scanners are a little bit more closed, and what I mean by closed is that they don't allow you to have an open file that can be sent anywhere. So that's another big thing that I would be looking at to make sure that whatever scanner you choose must be able to have an open STL platform, which means that the file can be viewed by anybody anywhere. They don't necessarily have to have that particular software in place. Okay, so in short, I would be asking myself, number one, what am I using it for? Number two, I would be speaking to my lab and seeing what they would advise. Number three, I would be looking at the functionality of where I want to go. And number four, most importantly, make sure it's an open system. Once you have those, then you can go and start to look, and that will narrow you down quite quickly to a few brands, and then it's which one you feel is best for you. Once you have looking at the actual purchase part of it, I would take the cost of it out of the equation. Cost is very important. I completely get that. However, in digital dentistry game, if it's cheap for a reason. Okay, there's usually hidden costs somewhere, and the hidden costs is in subscriptions, annual subscriptions. So make sure you know what they are. Make sure you know what the backup is that you're going to be provided with. If you don't have the backup and something goes wrong, that scanner is absolutely worthless and it will just drive you crazy. So you need to make sure the backup, the support from the company is strong. And this is questions you need to ask when you're looking at purchasing. So once you have all that in place, you purchase your scanner. Welcome to the digital dentistry world. Start easy and then work your way up, and don't try to jump in all guns going straight away.
Okay, and following on from that, how often should we, excuse me, how often should we be looking to upgrade the scanner? How much does the hardware improve, and how often does it improve?
Yeah, good, very good question. So this is one of the things, depending on the scanner that you look at. There are some scanners out there. Now, I'm a KOL with 3Shape, so I'm going to be mentioning that one of the reasons that I got on board with 3Shape originally was because I asked myself all those questions. And one of the questions I asked myself was exactly that. Will I have to change this hardware? If I buy this scanner hardware now, in 3-5 years' time, is this obsolete? It's exactly like a computer. The day we buy a computer or a laptop these days, it's already out of date, and you've got a limited time frame, 3 to 5 years before you need to buy another computer. So I had a look at scanners, and for me, 3Shape kind of stood out because the hardware is not what changes. It's the software, and the software I get through updates. There are other systems out there that were hardware based, and you're quite right, after 3 to 5 years when they had other upgrades, then I would have to upgrade the whole hardware scanner, and that's the expensive part. So that's a very good question to ask when you are looking to purchase. Whether or not you have the truth told to you or not is a different matter. But for me, I can categorically say that 3Shape do not do that, and they've picked up on that very early. So that for me is a plus.
What's the next step in the digital workflow? I mean, I mentioned then about your treatment, but it's a bit hard to say because it depends on the treatment. So in the future, looking to the future, what do you think will be the next part of the digital flow? What will be implemented into a digital workflow, do you think?
I'm fairly confident it will be milling of crowns, milling of bridge works, milling of dentures, or more indirect restorations. Not milling, sorry, start again. I'm quite confident it will be printing, sorry, of indirect restoration. So printing of crowns, printing of dentures, printing of bridges. Printing technology is coming on leaps and bounds. We can already print composite single crowns, onlays, veneers. So it's just waiting for the material really to be discovered. So I think that is the future. I think we will be seeing many and AI is massively going to be involved as well. So I think what we will see moving forward in years to come, and it's very exciting, is that you will scan somebody, you will have an AI designed prosthesis, the indirect one we're talking here, and then this can be milled out on site. So it's taking the old kind of CEREC style and the milling style that we have currently, and it's taking that and it's moving to printing, but using AI to facilitate the pathway. That's where I see it going. I think it's really exciting. And we are already in the position now of having AI generated smile designs. So you can sit there with a patient. Now you can scan them, and within 5 minutes, you have a full AI designed, 3D designed smile design for them to look at. So that's already here, that's already now, and that's really, really powerful. Then with that, it's so super easy to do subtractive dentistry. So you subtract their existing teeth from their design. You're left with files, which are your veneer files, and you can print them. So this already exists, and we do this in our clinic already. But I think moving forward, AI will make things easier for everyday clinician getting involved in digital dentistry.
Thank you, Chris. That's everything I've got. Is there anything else you'd like to add? I think at this point it might be, excuse me, an opportunity for you to mention that you'll be speaking at the dentistry show, which is in May, and you will. Is it and also a chance? I assume the BACD will be there, so it could be a chance to speak to people from the BACD, and it might be an opportunity to just mention that as well. But the show is the 17th and 18th of May, so yeah. Anything else you'd like to add?
Yeah, so I'm really excited to be lecturing at on the Friday the 17th of May in Birmingham, and really what we're looking at in that particular lecture is the full digital workflow for smile design with people, with patients, and we're looking at the ability to do this pretty much all in-house using AI technology, using printing technology and scanning technology. There is workflows out there, but this particular workflow we're really excited about also involves a veneer carrier, which allows you to carry up to 6 restorations in one go, and you can seat these in one go. And it takes, 2 minutes to seat everything? One of the hardest things when you're doing smile designs is actually seating veneers. That's quite stressful. And so we have a patented design veneer carrier, which is used that can facilitate in the placement of the veneers. What I like really most about this particular workflow is because it is fully digital and the patient sees every step as we go. The patients are engaged in the process. They see their veneers they see their proposed design. They approve their proposed design, and by using scanning technology, when we get the final design, it is within microns of their proposed design. So they know exactly what they're getting. And that really is quite powerful, especially from the point of view of litigation, because the patient has approved what they are getting, and then we can prove that it is very, very close, if not identical, to what they approved. So using AI technology, using scanning technology, and using carrier systems, we can reduce our stress, we can increase our profits, we can give the patient a better outcome, and it's truly a win-win-win. So I'm really looking forward to showing that pathway.